Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. Excuse me. We're taking your calls at 866-870-5752. That's 866-870-5752. When you phone, you get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy. And go to the website, check out Dr. Darrow performing these treatments on video at www.lastemcells.com. That's lastemcells.com. And right now we are speaking with Edgar.
Edgar, hang with a second. I just want to say free copy of the book by calling in now. Free copy of the book by going to the website, www.lastemcells.com, or by calling my office at 800-300-9300. This book has, how many studies were in it?
267. 264 or 260? A, B, or C? All of the above? None of the above.
So it's all about research, and I'd be careful about what you read on the internet. There's a lot of bunk out there. There's a lot of guys doing the stem cell work that shouldn't be doing it. They're not even MDs. A lot of them are physician assistants, nurses, whatever. They have no idea what they are doing. The results from them are terrible. Be careful to go anytime. People ask for referrals. I go to the doctor who does the most. I think I'm that guy, but we'll see. At any rate, we're talking to Edgar, and Edgar's got hip arthritis. And right now, Edgar, you're about 95% better than you were. Why?
It's still definitely a problem.
No, I didn't say it's not a problem, but why did it get better?
Well, I think it was some of the vitamins that I took. I took a fish oil and
good.
Turmeric.
Fish oil is anti-inflammatory. Turmeric is anti-inflammatory. Excellent ideas. But let me comment on something. It may not be the arthritis that's causing your pain, because the things you took get rid of inflammation, right?
Yes.
Well, if you have arthritis, you still have arthritis. It didn't go away, right?
This is why I called.
Yeah, you're a smart man. So this is the point. People come in with arthritis anywhere in the body. They're ready for a joint replacement. And I laugh and I go, yeah, you got some arthritis, but big deal. It's not a big deal. You know, it's just not a big deal. It's not even the pain generator. And when we get into the hip, it's very complex. You've got not only the hip joint, you've got the greater trochanter, which is on the outside of the femur bone, which is a lump that all the muscles attach to. So a lot of times people come in, they point to the side of their leg, and they go, here's the pain, and I'm going to have a hip surgery next week. And I go, well, that hip surgery is not going to get rid of this pain because it's 10 universes away from where your pain generator is, even though it seems close on the body. So be careful. Don't get these surgeries, please. Check with a guy who does, or a woman who does regenerative medicine. Grow the tissue back. Don't cut it out.
Doctor, may I ask, I just have this one question that keeps niggling in the back, because when I sit and then I stand, for 10 minutes I can sit and stand up, I'm like a cripple for 20 steps. But then that'll go away. There's just some odd thing about sitting, some angle gets some kind of geometry.
Well, part of it's this. You did admit, thank you so much, that you're 20 pounds overweight. That's got to go. Okay?
All right.
No ifs, ands, or buts. You got to drop that weight starting right this second. And you can do that by cutting out your carbs, eating protein, vegetables, fat, and water. That's it. You can do that. You'll drop that 20 pounds in, 3-4 weeks, 5 weeks. We have a diet in the office, Ideal Protein, that'll do it for you. It's very, very simple the way we do it. So it's your choice, but you got to drop that weight. when you're getting up from a sitting position, there's a lot of pressure that's put on your joints, your knees, your feet, whatever. And with that extra 20 pounds, it makes it a lot worse. So you're in good shape. The fact that you're so much better now, hopefully, we can find out where the pain generator is, heal it up using PRP or stem cells, and get you back on your feet, get you happy again, get you skinny again, and then you and I will go out and play golf together.
Well,
All
there's
right.
still something. All right. Do I get a book for making this call, or I got to call?
Oh, yeah. We're going to, you know what? If you want, I'll send you a box of books because you're such a good guy. That sounds funny, but when people get healed by these treatments, they ask for a box of books, and they hand them out to their friends, and they become proselytizers for me. They become evangelists, because when you get healed...
Don't I still need the injections to add some lubricant, labrum or whatever cartilage?
Well, the labrum is, it means lip in Latin, labrum. And that is just it's like a sleeve around the joints that helps hold them into place. And you may have a labral tear, but that doesn't necessarily cause pain. The main thing is get into the office. The phone number there is 800-300-9300, 800-300-9300. Get into the office. Let me take a quick peek. I'll tell you what's going on. We'll give you a quick exam. We'll look with the ultrasound if you want, see if you have a labral tear or arthritis or whatever it is, and get you set up.
Show arthritis, so. But
it may not be. That may not even be where your pain is coming from.
I see. Okay. Yeah.
We may find something totally different.
By long delays in getting, I was ready to get a hip replacement, and at the VA there's such a long time.
Lucky for you.
Yeah, because during that time, the pain, 95% of it went away, and I thought, well, what the hell is this?
Yeah. I love the stories because
things are separate. They're separate.
That's right.
The pain
that's right.
is separate from the joint.
That's right. And, I worked at the VA for 3 years. I went to a residency program at UCLA, and the VA was one of the hospitals that we rotated through. And I was always happy because it was so slow to surgery, because by the time it was time for the surgery, we'd get them healed. Yeah. They never, and we get callers all the time, don't we? Needed to call up and go, yeah, I was told I needed a knee surgery 20 years ago. Right. I never did it, and I'm fine today.
That's right, all the time.
Yeah, and we're going to find, the day is going to come. I don't know when it's going to be. The day will come when we look back and we go, why did we ever allow doctors to do surgeries when it shouldn't have been done? Now we're just regenerating tissue. Look, I love surgeons. They do the hardest work in medicine. It's scary work. But it's overused. It shouldn't be used on these little procedures.
Yeah, I had a naval hernia, and that surgery was absolutely necessary, at least in my mind, and they did that.
Well, you lose the 20 pounds. You lose the 20 pounds. It may not have been necessary because that's just pressure from the fat in your gut.
All right. I'll get that diet.
Yeah, you don't see many skinny people getting that surgery.
Yeah, there's something to that, right?
So get busy. Get busy and keep your mouth closed and be hungry.
I was just going to go into the market here and get some big donuts, so I guess I'll cancel that.
Get some apples and bananas and avocados instead.
No, Nita, no bananas.
Oh, okay.
They're high glycemic.
Okay, I stand corrected. Okay, so apples and avocados. Vegetables.
All right, apples or, Lily.
Nita, you probably remember, about 10 years ago, I did an avocado diet for 9 months.
Yes, I do remember.
A dozen a day.
I do remember.
Yeah, it gets rid of all the inflammation of the body. It's basically pure fat. And fat. It made me skinny too. Fat makes you skinny.
Yeah, I've become a believer in the fat. I even eat butter, have butter patties on my toast.
Well, you and I are going to have a conversation.
Is that good fat or?
Okay, the toast has to go.
is a grain. It's a carb. You got to let all the grain go. So what you're not going to be eating is you're not going to be eating grain, dairy products, fruit other than berries, which are low glycemic, no alcohol, no sugar. You do that, you're going to be skinny like me.
All right, doctor, I'll give it another try.
You won't give it a try. You're going to do it. You're going to be a Navy SEAL.
Trying isn't doing. Just do it.
No, you talk. You know what I like? I like all my patients to read a book on the Navy SEALs. They don't try anything. They go 180%. They don't give up, and that's what we have to do to stay healthy. We can't give up. No cheating.
All right. Appreciate the cheerleading.
Thank you,
God
Edgar.
bless you, my friend. You're a good
Take
guy,
care.
Edgar.
Okay.
There's good
Talk to
hope.
you later. Bye-bye.
Take care.
Good hope for
Bye-bye.
you getting rid of your hip pain.
Our number is 866-870-5752, 866-870-5752, and we're going to Allison.
Allison, Dr. Marc Darrow, how are you today?
Hi, good. How are you?
So, are your knees like popcorn?
They are, and they've pretty much always been like that. I mean, I'm only 23, so I'm a little concerned, but it's been a lot more the past few months, and I can, when I put my hand on my knee, I can like feel it pop underneath.
Are you Northern European?
No.
What's your ancestry?
Eastern European.
You're Eastern European. Okay.
Yeah.
You're not blonde, are you?
I'm not. No.
Okay, good. The reason I'm saying that is we get people that are, from the northern hemispheres way up north who have laxity in their joints. And, Irish people, Scandinavian people, Scottish, English, you name it. And,
okay. No, that's not my ancestry.
Okay,
no.
so what happens with those people, you still may have the gene, okay? Because if you're Eastern European, there were a lot of the northerners that migrated down. But you could have it anyway. And what happens is your patella is probably out of the track called the trochlear groove in the femur. And so it doesn't slide as easily as it should. We call that patellofemoral syndrome. And you can look that up. It usually is easy to fix. 1 to 3 treatments with PRP, which is process of just drawing your blood, spinning it, and injecting the platelets. Or if it's severe, I would add some stem cells to it and regrow the back of the patella cartilage.
Okay, so it's a bit out of place, you're saying?
Yeah, it's out of place, worn. Are you a long-distance runner, or have you ever been when you were young, or basketball?
I did cross country when I was in high school.
There you
not
go.
Very much
There
long
you go.
distance, but
Well, cross country is pretty long distance compared to the average couch potato. So yeah, that's a setup for what you have, and I get a lot of you guys as patients, and we heal them up. So there's good hope ahead for you. I wouldn't be nervous about the cracking and all that stuff. And some of the telltale signs, we call it pathognomonic signs, are sitting in a theater, the theater sign where your knees ache, sitting in an airplane for a few hours and the knees ache, and going up and down stairs is a problem. But the nice thing is by injecting the knees, we can help get rid of that and make you feel a lot better.
Okay, so it's related to, because I haven't had pain so much the way you're saying about the achiness, but sometimes when I've been a bit more active, I'll have like one knee for one day, and it'll like go away and be more achy and like a dull.
Well, you may have a very mild case of patellofemoral syndrome.
Okay. Okay, well, thank you.
All right, God bless.
Thank you for your call, Allison. Bye. Take good care. Our number is 866-870-5752, and the website is www.lastemcells.com. That's lastemcells.com, and we're going to Jasmine in Shadow Hills.
Jasmine, I understand that your husband has joint pain. Which joint?
Finger joint. We're assuming it's arthritis. We're not sure. We used to take some minerals, one a day. It's MSM.
I'm sorry, I didn't hear what that was that you took one a day.
It's a powder mixing with trace mineral. It's a combination of minerals. It was helping.
Okay,
but
good.
It's almost a week that he's waking up with pain in both sides of his hip. But after he starts walking, it's kind of getting better.
Okay.
Lately, he does more workout. Means the workout is treadmill, and sometimes from my point of view, he's overdoing it. I'm not sure.
Okay. How old is your husband, Jasmine?
69.
Okay. So, he's got 69,000 miles on his tires. You know what I mean?
Knock on the wood, he's in good health. He's in good shape.
Yeah. Well, I'm glad to hear that.
You're right.
But the point is, you might want to turn your phone off.
Yes,
but the point is that he does have some wear and tear on his body. He's active. Is he overweight?
No, not at all.
Okay, good. That's helpful. And he may just need a tune-up, just like, tires can be retreaded, and his joints may need some tune-up by just using some regenerative medicine, which we do, of drawing his blood, spinning it, taking out the red cells, and just injecting the platelets, and regrowing some of the tissue. Sounds like what he has is not terrible. I do fingers all the time. They heal up very quickly, and hips all the time. And I think he's in good shape for trying regenerative medicine. Doesn't sound like anything terrible is going on. As time goes by, more and more people are doing regenerative medicine as a prophylaxis. I just had a gentleman come in with knee problems on the left knee, and he said, should I do my right knee? And I said, well, your right knee's not bothering me. He goes, right, but I'm a rock climber, and I think it's going to bother me because I'm really active. And I said, well, it doesn't hurt. And I think as time goes on and these procedures become more ubiquitous, and every doctor is doing them, which they will be, that we're going to see people doing this prophylactically. And
thank you so
I
much,
do it.
Doctor,
I do it prophylactically. If I have one joint that's bothering me, I'll do the other side too.
Oh, perfect. Preventing it.
Yeah, there's good hope, Jasmine, that your husband will get better. And I think regenerative medicine is the way to go. I've got to examine him first, make sure there's nothing systemic going on. Some people have different types of arthritis that ruminate around the body, and that can be checked. And sometimes an alkaline diet can get rid of these type of joint stiffnesses, okay?
Perfect. Thank you so much.
Thank you, Jasmine.
Thank you, dear. Bye-bye.
Bye-bye. Take care. Our number is 866-870-5752. Dr. Darrow's website is www.lastemcells.com. That's lastemcells.com. And remember, when you call today, you get a free book. Let's go to Jim in Woodland Hills.
Hey, Jim, Dr. Marc Darrow, you want to know about placental stem cells. What's the success rate?
Right.
Who told you about placental stem cells? Was it a chiropractor?
I've been reading about it for the last probably couple years. How they've had what do they call it? Some type of exosomes or something. Which are good.
Well, that's not stem cells. Those aren't stem cells. Those are cells. We find them, very readily in the bone marrow. Exosomes are cells that quiet down inflammation.
Right.
And cytokines, things like that stimulate tissue to grow. But that's not stem cells.
Okay. So then, but do you prefer using the blood from placenta for that versus instead of bone marrow for?
I don't use placental tissue.
Oh.
Okay, that's cells from a placenta.
Uh-huh.
That's different. I don't use that at all, and I don't know. Go ahead. Sorry.
Do you just use the bone marrow then for your injections into the hip?
No, I did. I've done thousands of bone marrows over the years. I was one of the first guys using it. But people are wanting cord blood now. They don't want to get the drill. Okay. So I've been doing a lot of cord bloods. I've been doing about 100 a month of those. And I offer the bone marrow if people want it. And on one very successful racquetball player, I don't know if he wants his name given out, Actually, he probably does. His name is Rick Betts. Rick, I hope you're listening.
Oh, yeah, I know Rick Betts.
Okay. And do you think he's a good player?
Yeah, I used to play him. I used to play him all the time.
Small world.
Yeah, well, we actually did bone marrow and cord blood on his left knee.
Oh, really?
With very good success, yeah.
Yeah, my brother had the same thing as me. We're twins, and he used to play racquetball also. So he had, same as me, but he had it at a younger age. He was in his early 50s when he got the problem with his hip. Then he eventually had hip surgery on one, then on the other, and he still played competitive racquetball. It didn't even slow him down. Matter of fact, his surgeon was so good that he was able to go back and play guys like Betts and still beat him.
Well, it's a fun,
but I prefer
close...
not to do the surgery if I don't have to. That's why I was wondering, what's the success rate?
Most people don't need to do these surgeries. I mean, the byline of our show is take the surgery out of pain. That means, you can have pain. It can look like you need surgery because that's our culture, but we're healing people without it. Using cells, biological cells, I think is the amazing way to do it. Go ask Rick Betts. He's doing great.
How many times would you need to do this for the hip for using the stem cells?
It's not a blanket answer. Everybody's different. Sometimes I'll see terrible pathology, very advanced hip arthritis or other, shoulder, knee, whatever, neck arthritis, and we'll do one treatment. The person goes, I'm all better. And I'm like, well, that was a miracle. And then sometimes, for a very arthritic joint, it may take a lot of treatments to get it better.
And what is the stem cell actually doing there? It's not going to grow the cartilage back, is it?
Oh, yeah.
Oh, it will, huh?
Yeah. Huh. And, this is a great conversation because no one's really sure what a stem cell is. I know that sounds crazy, but scientists disagree. There's certain markers on live cells that we call a stem cell. And what we're starting to think now is that the stem cells that we inject into you really just wake up the nascent stem cells that are already there. And they put them to work, and they start dividing and becoming the tissue.
Well, you know
so
how
there's
they
a lot
talk
of unknowns.
Do you know how they talk about stem cells being produced for people who have long-term 5-day fast, that autophagy concept?
Yeah. What happens when people go into ketosis? They start producing more stem cells, and we also know that growth hormone goes up when we're starving.
Right.
So there's a lot of things the body does to save itself from dying.
Okay, so maybe I'll give you a call. You can take a look and see what you think about the prognosis.
I'd love to talk to you. Sound like a great guy. Give Rick a call, and you can find out what his success is.
I see Rick every now and then, so I can talk to him about his progress.
If you want to,
is he still
what Rick does? Rick is unusual. He's one of my high-level athletes who comes in once in a while, even when he's okay, to prophylax, because he beats the heck out of his knees, right?
Right. Well, when you play racquetball at the level that we do, I mean, you end up, beating the heck out of stuff, so that's what happens.
Yeah. God bless you, Jim. We appreciate your call.
So sorry, we got to go. Thank you for your call, Jim. Okay.
We have a lot of callers waiting, and I want you to go to the website, www.lastemcells.com, or call the office at 800-300-9300. Thank you, Nita Valens and staff.
Okay.
And God bless everyone.
Thank you, Alex and Nick and everybody here, and we will see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.